My name is Natalie Hyder, and today I will be talking to you about agenesis and hypoplasia of the corpus callosum. Before we get started, in the disorder of agenesis and hypoplasia of the corpus callosum, there's a few things we should know about it. So this green part is the corpus callosum. It's a large C-shaped nerve fiber bundle found beneath the cerebral cortex. It stretches across the midline of the brain, connecting the left and right hemisphere. It makes up the largest collection of white matter tissue found in the brain. So there are four parts. You have the rostrum, the genu, the body, and the splenium. And they're color coded. And the yellow is the prefrontal, the orange is the premotor, the red is the primary motor, the baby blue is the primary somatosensory, the green and the bluish green and the blue, they're all in the back of your head. Well, except for the green, it's posterior in the parietal. The corpus callosum, it serves as a main communication pathway and carries information received in one hemisphere over to the other. So as you can see, here goes some demonstrations of how it looks. You can see that it's connecting the left and right hemisphere. And then this is how it looks lateral, and this is the frontal. The corpus callosum transfer motor, sensory, and cognitive information between the brain hemisphere. An increase in the callosum thickness helps the brain area develop, which correlates with intelligence, problem-solving activities, and process speed. So any problems with the corpus callosum leads to distraction in brain communication, which cause severe consequences. There are four types of different disorders within the corpus callosum. You have complete genesis of the corpus callosum. You have the partial agenesis, hypoplasia, and then you have abnormality due to hydrocephalus. The complete agenesis does not form all the way. It's missing all the parts. Partial agenesis is missing usually the back part, but sometimes in the middle and front part is missing. The hypoplasia, the structure is all there, but it's thin or is very small. And the hydrocephalus is too much fluid in the brain, causes the corpus callosum to not form properly. So let's get into the disorder. So agenesis and hypoplasia of the corpus callosum is a rare disease that is present at birth and diagnosed in fetus at pregnancy. Agenesis, we're going to call it ACC, is frequently diagnosed during the first 2 years of life. The cause of ACC and hypoplasia of corpus callosum is usually not known. It can be inherited as either an autosomal recessive trait or X-linked dominant trait. It may be related to a disorder of axonal development. It can be caused by infection or injury during the 12th to 22nd week of pregnancy, leading to a developmental disruptives of the fetal brain. The genetic conditions passed on from parents. It can be genetic conditions that occur at random. Chromosomal defects that affect fetal brain development, exposure of the unborn baby to certain toxins, in abnormal brain development caused by cyst. As you can see right here, this is the partial agenesis, where you can see the rostrum and the genu part of the body, but then the back part is missing. And then over here is the hypoplasia, which is very thin. You see it's all there, but it's very thin. So here are some characteristics of what a person may look like. You have an unusual face with a broad nasal root, widely spaced eyes, a very thin chin, lack of muscle tone. And then you have the mental retardation, you have visual problems, delay in development of speech, seizures, feeding problems, reduced sensory motor information, reduced cognitive process speed, reasoning and problem solving, failure to thrive. And then it may be linked to ADHD. To diagnose, we can use MRI, ultrasound techniques, and the affected patient are mostly asymptomatic, and it can be associated with other malformation syndromes. So here we get to the genetics. It can be a genetic from a factor by chromosomal abnormalities, trisomies 18 and 13, and with the autosomal dominant, it can lead to Apert and basal nervous syndrome. Autosomal recessive, it can lead to Joubert or Lyon. X-linked, acardie, and X-linked stenosis and hydrocephalus. And it can be associated with deletion and duplications. As you can see, you got 4, you have P16, deletion 6, Q23, duplication 8, P21, P23, duplication 11, Q23, QTER. And I found one study about the changes in the chromosome. Is the deletion of chromosome 6, which is rare. And among 28 cases with CQ, 6Q, terminal deletion, only 19 did a follow-up. And a follow-up to determine whether deletion was inherited or de novo effect. Well, in 19 of these cases, the deletion were inherited by a father, 1 case inherited by the mother, and the remaining 16 cases were de novo. And here goes some associate. I had just stated about the Apert and the acardie. You have the disconnection syndrome, and yeah. Then you have multiple sclerosis. So you have all these that are associated with agenesis and hypoplasia. So I found a case study. According to Kulak, the purpose of this study was to estimate the clinical profile of children with the corpus callosum abnormalities in MRIs. This case study carried out in 2011. In this case study, they had 20 brain MRI scans of children with ACC, hypoplasia, hypogenesis, or dysgenesis. It was analyzed by a radiologist or pediatric neurologist. Age range from 4 months to 17 years old. They analyzed size of ventricles, loss of white matter, the corpus callosum, the gray matter. More than half of the patients, which was 11, had ACC, 6 had hypoplasia, 3 patients had an absence of genu or spleen. ACC or hypoplasia of the calcium is present in more than 50 different human congenital syndromes with clinical manifestation ranges from mild to devastation. And here go some management. There are no cures. You have treatments to restore um, the corpus calcium to normal. You have medication, physical therapy, speech therapy, occupational therapy, speech education, physiotherapy, parent training, psychotherapy. And here is my tree. So as you can see, so the common ancestor will be here, and there are two lineages. The last three are the outgroup, and the first four, they are alike. They're almost alike. The ancestor gave lineage to the first four and branched off and gave lineage to the black snob-nosed monkey. So that is basically concluding my presentation. Thank you for listening.